All right, now let's take the conversation to a global stage. World AIDS Day, observed annually on the 1st of December, is an international day dedicated to raising awareness of AIDS epidemic caused by HIV infection. Now, it's also a day to remember those who have died as a result of the disease, as well as to promote HIV prevention, treatment, and care. According to Statistics SA's 2022 Media Population Estimate Report, South Africa has the world's largest HIV epidemic, with approximately 8.5 million people living with HIV.
The report revealed that this year alone, the estimated number of deaths from AIDS in South Africa stands at 85,796, while in the previous year, AIDS-related deaths in the country reached nearly 88,000. This year's commemoration is held under the theme Equalize and Integrate to End AIDS, which serves as a call to address persistent inequalities that impede the country's efforts to end AIDS. These inequalities include poverty, exclusion, inadequate access to services, particularly by key and vulnerable populations, including transgender persons and sex workers.
Joining us now to discuss this even further is the CEO of the South African National AIDS Council, Dr. Thembisile Xulu. Thank you so much for joining us this morning. Dr. Xulu, a lot has happened in the last 2 decades. Thank you for joining us. A lot has really happened, of course, in the last 2 decades in terms of the progress in containing the virus's spread. Can we recount our victories so far? What victories would you say we've seen on the global stage in the fight against HIV?
All right, so in the global fight, I'll mainly limit it to how South Africa benefit to the global fight. I would say that, ARVs did become available globally, but South Africa was not fortunate in the sense. And when we eventually had civil society moving forward, trying to get us the treatment, we were then quite fortunate in that we had access to treatment, which not only helped to improve the quality of people's lives, but also helped to prevent the transmission of HIV infection from pregnant mothers to their unborn children. We then went a few steps further, where we started changing treatment, because the treatment that we were initially using was quite toxic in terms of fat distribution and lactic acidosis and some harmful effect on humans' bodies. And that change was made. We switched to a much friendlier drug regimen called TLD, which doesn't have as many side effects. But more importantly, it's also 1 tablet once a day. So there was no longer the issue of the pill burden. I think we've since progressed now to a point where we are moving towards even trying to expand prevention methods that are female controlled, which is what we want to see, because we know how women struggle with negotiating condom usage. So we are at a stage where within our regulatory authorities, things like the dapivirine ring, as well as the long-acting cabotegravir intramuscular injection, which are pre-exposure prophylaxis, are along the pathway of approval. And these are the ones that are meant to make sure that women and young girls and women in general have got access to prevention methods that they can control, and that they can actually protect themselves from HIV without seeking the consent of a partner. But for South Africa, I would still say the biggest win is that the bulk of the treatment for HIV and for TB is funded by the fiscus. And I think that is quite a different picture when you look at the rest of the SANAC countries.
Okay, let's also talk about, information. Would you say the general public is still seemingly uninformed about HIV testing and knowing their status? And how so? And also, is there still a stigma causing lack of testing and, finding out more about HIV?
Yes, I think what COVID did for us, unfortunately, was that people seem to have forgotten that HIV even is a problem in this country. I remember, having a conversation with a patient, and they were like, "Oh, HIV is still around." So people seem to have thought that COVID took HIV and TB away, and that is not true. If you look at now, we are no longer aiming towards the 90-90-90 UNAIDS targets, or the global AIDS strategy targets, but we're now talking 95-95-95. And as much as South Africa is at 94, 76, and 92. We are doing well in terms of testing and in terms of the last 90, but the middle 90 is the one that's the most important, which is about putting people on treatment. And people are not on treatment either because they don't know their status or because they fell off during COVID and just never came back because maybe they were afraid of contracting COVID at a health facility. There could be many other issues like drug stock out, etc. But the bottom line is that people, I would say we can never give enough information about HIV because once you're on treatment and your viral load is suppressed and undetectable, you have a good quality of life, almost as good as somebody who's HIV negative. You also then have a close to zero chance of transmitting that HIV onto the next person, which is what we call U equals U, undetectable equals untransmittable. And that is when people are well. And when people are well, there's no need for stigma because we all look the same. We all feel the same. There is no immune destruction. And if people are taking their treatment well, it goes a long way to fighting the stigma and discrimination. Hence the theme Equalize, because we want to make sure that key and vulnerable populations have got equal access to treatment in order to make sure that they lead a good quality of life.
I mean, it's very important that you shared, these points that you just did to remind people that when they take their treatments, they can live the best quality of life and get their viral loads undetectable. And they can get married and even marry people who are HIV negative. And, I think they're called magnetic couples. Now, let's talk about the theme of this year's commemoration. It's Equalize and Integrate to End AIDS. What would you say are the critical steps that must be taken to achieve equality in the face of this epidemic? And how will this benefit everyone?
All right, so I think if you look at the body of SANAC, SANAC is a multi-sectoral body, which means we bring together all government departments, we bring together all 18 sectors of civil society, we bring together the private sector, our development partners, labor. And when we say inequalities, we are saying that the people that are most affected by HIV, TB, and STIs are the poor people. So it's the same poor people that need jobs, and jobs is Department of Labor. They need houses. Housing is the Department of Human Settlements. It's the same people that need social support. That's the Department of Social Development. So all that we are saying is that if we have to get to the heart of addressing their health issues, we have to make sure that we address the social ills that accompany those. And people like sex workers, for instance, struggle to access health services at health facilities because the moment they self-identify as sex workers, a nurse might decide not to give you treatment if she doesn't believe in it. So we are saying, let's treat the HIV response as a human rights-based response, which means whatever your social orientation, whatever your gender, regardless of where you come from in terms of whether you are rich or poor, you have got equal access to the basic services, including testing for hypertension, so that we integrate the testing for HIV, TB into the testing for STIs, for hypertension, but now also important mental health, so that as we integrate, we are able to lift the stigma out of HIV, because the people with HIV are the same patients that have got diabetes, same patients have got hypertension. So once they get their treatment, they live a good quality of life. You can tell the difference, that this one has got HIV and this one doesn't. So if we equalize, we really make the playing field equal to all South Africans in terms of access to quality healthcare and treatment.
All right. Thank you so much, Dr. Thembisile. We, of course, will look forward to speaking with you again. There's so much more work that needs to be done, not just in South Africa, but across the continent. And we hope that we continue to spread the message. Thanks for your time.